Thank you very much. Good morning, everyone. Bienvenue tout le monde.
Welcome, everyone. Good morning. I really appreciate the opportunity to be with you this morning. A few comments before opening up for your questions. I'd like to start with the health subject of priority number one of our government.
Okay. It's not just me. Something changed with the sound, but we'll continue anyway. I want to start off by talking about healthcare because that is the number one priority of our government. And there's a couple things I just wanted to touch on for the people of New Brunswick. First, you may be aware, but I want to confirm that we are in negotiations with the New Brunswick Nurses Union on a new contract for nurses. And we're also in negotiations with the New Brunswick Medical Society for the agreement between the government and doctors. And so those are two really important pieces of the work we're doing to ensure that every New Brunswicker has access to the care they need, where they need it, when they need it in their communities, and our need to transform primary health care as well as many other parts of the system. So those are really good conversations that are progressing, and we look forward to being able to provide you with more updates shortly. Nous travaillons activement avec le Saint.
We're working actively with the New Brunswick Nurses Union in New Brunswick as well as the Medical Society to put in place a new contract for the improvement of access to health care here in New Brunswick. And these are good conversations that are continuing, and it's a priority for us to succeed in having new contracts so that we can continue to transform our primary health care system and to improve access to care for each New Brunswicker in their community at the right time with the right services for the right person. That is essential to ensure New Brunswickers have access to care and to improve working conditions for those who care for us.
Ensure that New Brunswickers have access to the care that they need by making sure we have the right working conditions in place and the care for our caregivers that they deserve. So talking about caregivers, I want to move over to the critical state in hospitals on the horizon side of things. My colleague, the Minister Cindy Miles, spoke to this yesterday, but I wanted to add some emphasis to the points that she made and acknowledge the situation that Horizon has flagged that is happening in a number of the regional hospitals around New Brunswick. And this isn't a surprise, I think, to New Brunswickers or to our government. We have seen over many years the challenges that hospitals have faced, where we have times of heavy emergency room activity, and yet hospitals that are full of people receiving alternate levels of care. And that 650 patient figure that Horizon cited is one of the highest that we've seen in a long time. It's increased significantly from the 500 and some that was the case a number of months ago. This is something that our government started working on as soon as we were sworn in a number of different ways. The first way that I want to talk about is with home care, because the ideal situation is that people do not find themselves in the hospital in the first place because they can get the care they need at home. And we have been working diligently with home care service providers and with our policy analysts to get the right system and supports in place, working conditions and wages in place so that New Brunswickers can access home care as well as the equipment and supports that they need to stay in their homes as long as they like, where they're likely to be healthier for longer. Alors, ce travail continue
So we're working really hard to support healthcare at home in New Brunswick and remuneration and the support available and the complete system so that New Brunswickers can continue to stay at home with the neighbors, their friends, in a way where they are going to have a better welfare for the longest time possible.
Is the work that we've been doing with the Nurses Home Association and unions. We were really pleased with the contract that we were able to negotiate with those critical workers in our healthcare system, and that has helped with some of the staffing challenges that we've seen in our long-term care, special care home, and nursing home facilities. So it's critical that we have a strong long-term care sector with the right people earning good wages with good working conditions all over the province so that that the capacity is there to provide people with the level 1, 2, and 3, and 4 care that they need should they need it. And so we recently concluded those contract negotiations and are pleased to see some of the progress being made with staffing in long-term care since then. Folks around the room will know that we have continued to expand the Nursing Home Without Walls program so that people who are at home but may need the kinds of care that aren't available at home can participate and get access to those services, equipments, and engagements in more and more long-term care facilities around our province. The amount of utilization of the Nursing Home Without Walls program has been encouraging, surprising even, how many services are being rendered to seniors across New Brunswick for them to be able to stay home but get that extra social contact, social services support, access to those great tubs and other equipment that our nursing homes have in order to stay home longer. So that piece of work is continuing as well. And then there's the work that we've been doing on primary care to transform people's access to get the care they need in community from family health teams to prevent them from showing up at the ER and requiring the kind of admissions that are challenging to do right now when there aren't available beds. So there's all sorts of pieces that have been underway since we were sworn in. We put significant investments in our budget last year. You would have, well, last year, March of this year, good heavens, only a number of months ago. We mentioned at the State of the Province in January that our government is prepared to be measured and held accountable on this point, specifically in relation to the number of seniors waiting for care supports. That number was around 1,068 when we set it for last year, and so we continue to track that number. And given the projections for increase, our goals have been for it not to increase and ideally to decrease that number. But as Horizon's call for crisis protocols reveals, there are more and more people in hospital right now waiting for the supports to return home or the ability to go and receive care in a long-term care facility. And so we have heeded their request and given them that support for a 30-day period. And there's some work to be done around the policy changes that may need to be put in place to try to prevent this, what seems like a regular cycle, to stop for the long term. And so that's where those investments in home care and the conditions for people in long-term care and the primary care work that we're doing come into play to try to prevent this in future. Je vais répéter un petit peu en français.
I'm going to repeat a bit in French for us. The state of our hospitals, their needs to have better work, to do better work, to ensure that our seniors and all New Brunswickers receive the care that they deserve or when they deserve it, starting from our swearing-in ceremony. It starts with the work of our care at home. So we're working to improve the home care system and remuneration and the available supports so that it can be affordable and accessible for everybody that needs it, because everybody would prefer, and the results are better actually, to stay at home and to keep in better health close to your neighbors and friends. So that is the first priority of our work in long-term care. We're continuing our work with nursing homes and the unions and the association, Nursing Home Association, with a new contract. Everybody was happy to put in place a new contract that helps us with the needs of the manpower in the nursing home sector. So we're seeing that the positions are being filled and the work for recruitment and retention is improving, and it's continuing. So it gives us more beds available to be used for, like Horizon pointed out. We're also doing the work for healthcare without walls, so it's to increase it. I'll give credit to many former governments who have started the programs and are continuing to improve the program. We're continuing that work really hard to make sure that all our resources in the community are being used for those who want to stay at home, but maybe we deserve to have access to programs and tools that exist in our healthcare system, long-term healthcare system. So we have nursing home, healthcare, the workers and the nursing homes without walls in partnership with our extramural nurses, and that improves our transformation and for primary care in the community to avoid what must happen in the emergency rooms in case where there are no other options in their community. We're going to try to avoid to get them to the hospital to put the pressure on the beds that are not available for being admitted. And we want to avoid people have to stay in the hospital by waiting for support at home or to have a place in nursing homes or long terms. And there's a policy that manages that system. We said yes to the request from Horizon to have the opportunity for the next 30 days to use the emergency care system to prioritize their patients in order to find or to be moved to beds available in our nursing homes. And these are conversations we'll have with the families, with the people who are involved. And there's a change of policy to try to better manage the situation and to avoid finding ourselves here again in another few months, like we've seen for many years with this aspect.
To talk about was Canada-U.S. relations, because maybe not unfamiliar to me being in this room. It seems like when I'm in this room, we're talking about tariffs and President Trump, and here we are again on the receiving end of another letter from Trump suggesting an increase in tariffs to 35% across the economy. And our team continues to take this extremely seriously, as much as history has proven that these kinds of letters and suggestions from Trump are fleeting and are prone to change. We are still focused on making sure that the supports that New Brunswick enterprises need to weather these times of uncertainty are there, whether that's to help them make sure that they're CUSMA compliant for any goods or services that are crossing the border, whether that's to help them adjust to increased costs that they're experiencing because of some of the tariffs that have been put in place already on steel and aluminum, and whether that's to continue to help them find new markets as our relationships and partnership opportunities grow with Europe, with Africa, with Asia. The programs that we announced back earlier this year remain in place. The financial supports remain in place, and your government is there to support entrepreneurs and their workers through this continuing tariff uncertainty, as well as play a key role on Team Canada, working with the federal government to ensure that we are moving forward in unison to fight these tariffs and to engage to secure Canada's economy, to make us the strongest economy we can, to be an energy superpower, to expand our relationships in the world while negotiating this complex relationship with the U.S. in a way that is in the best interest of New Brunswickers. Alors, ce travail continue.
So this work is continuing.
Businesses that are feeling the impacts of tariffs, please do not hesitate to reach out to Opportunities New Brunswick. They have a team there ready to take your inquiries and to work with you on what your business is experiencing and what you need. And the same goes for businesses in our agriculture and aquaculture and seafood sectors. The Department of Agriculture, Aquaculture and Fisheries is there to support you with programs. And so I would encourage you to continue to reach out to those incredible teams who are ready and willing and able to help out. Alors, le Nouveau-Brunswick
So New Brunswick continues to live through the reality of a president of the United States that changes his mind every second minute, and we're hearing that this letter is a suggestion of 35% tariffs on our economy, which is coming August 1st. We found out that the Trump's proposals are not typically not permanent, and they change every day. But for us, we're always ready to help you and ready to fight against the terrorists in the United States and to do the work with the Canada team and the Prime Minister and the federal team to make sure that our economy is supported, protected, and that our relationships with the new countries exist, and that the supports are there to help our entrepreneurs and their workers to broaden their work, their clientele in Europe and Africa and Asia, and that the supports are there and for increased costs because of the tariffs that already exist on aluminum and steel. So we are always vigilant, and opportunity New Brunswick team are there to help you. Support still exists to help you with the impact of the costs and opportunities that the businesses experience with today's economy. We are concerned. It is clearly serious that this battle with our international trade and the tariffs are continuing, and we do everything possible to protect and to strengthen our economy here in New Brunswick so that we can resolve these issues with the United States and to find ourselves in a better place after all this business. So I believe
with my usual message of recognition for all the New Brunswickers that have been out there supporting New Brunswick businesses, buying local, buying Canadian, continuing to demonstrate their support for our entrepreneurs and our economy in their purchases and in their summer habits with their tourism and hospitality choices of staying in our province, in our region, discovering new Canadian opportunities in tourism. Our operators are feeling those differences. Our entrepreneurs are seeing that in the local purchases. I very much appreciate how New Brunswickers have come out to support our province through this, and that loyalty and that pride. I'm very grateful for it. Alors, je vais vous remercier.
So I'd like to thank every New Brunswicker that are continuing to choose purchase local products with the Canadian products, and they chose to stay in our beautiful province for their summer vacation, and they're choosing to visit the region and other Canadian places at this time to support the province of New Brunswick. I really appreciate. Thank you very much. Merci.
Thank you, Premier. We will now proceed with questions from members of the media. Each reporter will have one question and one follow-up. I will give warning that the Premier does have a meeting at 10:30, but we will try to make it to everyone. You have the right to pose your question in the official language of your choice. Nous allons maintenant procéder.
We're now proceeded to media questions. Each media person will have one question and a follow-up question. You have a right to ask the question in the language of your choice.
Alternating between members of the media in the room and online. First, we will go to Jacques Poitras, CBC.
Hi. People in Miramichi West haven't had an MLA since March. When is that by-election going to happen?
We haven't scheduled the by-election yet. Right now, I think parties are in the process of nominating their candidates, and we will make sure it is scheduled before the date in October that is the deadline.
Is this new gas plant that's proposed a project of national interest in your mind? Do you think it should be subject to some sort of expedited approval like Bill C-5 allows for?
The project with the gas plant is something that NB Power started back in 2024 as part of the need to make sure that we are continuing to do everything we can to balance and provide affordable power to New Brunswickers. And so we haven't considered it a project in the national interest. It's been part of NB Power's sort of standard operations to ensure they have the load required to meet New Brunswickers' demands. So right now it is not on the list to receive any fast-tracking benefits that may come from what C5 has put in place.
Alex Villeneuve, Radio-Canada.
Concernant les lits d'hôpitaux, là.
Concerning hospital beds, there's a hospital that requested priority for their patients. I'd like to know, in 5 hospitals at the present time, with all that you've said, can we see reasonably, let's say, within the next year, the light at the end of the tunnel? It's been for years that this has been lasting. Patients are waiting to get in hospitals, waiting for nursing homes. When are we going to see that, the end of that? I appreciate the question because I believe everybody wants to see the light at the end of the tunnel. But with our projections, our demographic projections, it's not ready for tomorrow because we have a population that has become more and more we're getting older and older. Many more people are going to obtain health care, that we have the capacity to service them. And the creation of new beds in nursing homes, it takes time. It takes years to create new nursing homes. And we want to change the habits to make sure that we can stay at home as long as possible. And at the present time, the system is not strengthened to more. There are more opportunities to improve that service. And we're hoping and we're forecasting we're forecasting that our interventions, our transformation of the primary healthcare system is really going to reduce, what's the word? The pressure on emergencies with people who are there and that could be serviced in a family health care clinic with that access. So we're forecasting that each New Brunswicker is going to have access to service and a family team in their communities within the next 5 years. And with the reduction of the pressure and with the expansion of nursing homes without walls and health care at home, and with new beds in nursing homes, that we're going to have the opportunity to better service the patients who are now more than 1,000 people who are waiting for services they're not receiving. But these 1,000 people, the projections say that they're going to increase. So all our work to increase our services, it must go faster than the evolution, demographic evolution. So I can't put a date on the light at the end of the tunnel where we see the light, but we're working on it with our needs, what we have, and as quickly as possible, because I agree completely with you, New Brunswickers. It is something that we've been hearing for decades, that we see, that we've been talking about it, and there are moments where it's more serious, some other times where we hear less of it because it's not the season for the colds or other issues, but it's been continuing for many governments and over many years. So we're working really hard at each end of the spectrum for primary health care in the communities to avoid home care, to avoid the preventative investments that were not made. Otherwise, typically, it was long-term care and support for hospitals and for tertiary care. But no, we're at the end of prevention to make sure that everybody can have access in the best place possible. And we're improving conditions with person, and we're increasing a service without walls, help without walls, and to listen to New Brunswick, what they want, how they want to live, what they want for the hospitals and the choices they make, and in nursing homes for long-term care. So I'm sorry that I can't say that it's going to be 2029 on April 21st. We're working to try to catch up and ideally to get to a point where it is not a conversation that we have in the hospitals to have a balance of beds they need to service the population, and that we have community health care and at-home services that we need for a population that is increasing in New Brunswick, and projections for increasing in the population are not as large as they were, but that is the objective. Absolutely. Equally on the central at Tantramar, I understand the approval for proposal started before tariffs, so your province and NB Power cannot redo a new call for proposals, request for proposals. But in February, you said that everything was on the table to encourage Canadian purchase, and once again today you're telling New Brunswickers to purchase Canadian, and visibly it doesn't apply to NB Power. So I'd like to know. They chose an American partner. Yes, that an option that was on the schedule that the federal government to put in place to have this project completed. I believe in 2028 they had a schedule, but nobody submitted a project that would succeed the objective and the schedule that was given by the federal government. And it was also the submission with the least expensive of all others, so there's no Canadian option that would give us the opportunity to reach the objectives that the federal government put in place on the system. Just a question. NB Power said they chose an American because it was less expensive and because they were fulfilling the schedule. Now you're saying there's no Canadian option filling the schedule. That's what from what I understood. It was the only option to fulfill the schedule. So it was the choice with the objectives that we had.
Going online, Adam Harris, please unmute your mic and your question.
Thank you. Thanks, Premier, for taking our questions. Prime Minister Mark Carney said yesterday that his government is open to considering limits on how much softwood lumber can be exported to the U.S. in efforts to resolve the longstanding dispute. In effect, that's a quota system. I wanted your thoughts on that. Is the New Brunswick government now in favor of a deal that includes a quota on wood if it gets a deal done?
We're really glad that the Prime Minister is talking about softwood lumber. It's something that I was actually just talking to the Governor of New Hampshire about yesterday, because we have integrated economies between New Hampshire and New Brunswick with the movement of logs and lumber products. And so we want to see softwood lumber on the table in these trade talks. The tariffs that are currently in place on softwood lumber are damaging to New Brunswick, and the forecast that those tariffs are going to increase significantly has put a real chilling effect on a critical industry for our province. And so New Brunswick has been actively involved in discussions with the federal government as well as with our neighboring provinces across Canada that has interest in softwood lumber to get that back on the table and into the trade talks so that a new and better deal can be put forward. The components of that deal, quotas and others, are pieces that we're discussing and debating right now to find the best possible deal for Canada and the best possible deal for New Brunswick's forestry sector.
And a follow-up, President Trump posted a video earlier this month on social media that took aim at New Brunswick seafood company Cook, brought up foreign ownership allegations, said Canadians were pillaging American waters. Trump did sign an executive order in April that openly alleged unfair fisheries trading practices with foreign partners. But at the time, it appeared to be about disputed waters around Machias Seal Island. I guess this is a multi-pronged question. I want your reaction to the video, but then I want to know, is there any update on your end onto how that executive order impacts the New Brunswick fishery? And then to your knowledge, is the fishing industry being talked about at all in the trade deal negotiations? Like Trump has a preoccupation with, say, dairy.
There's a lot in there, Adam. Well, I will say the allegations made in Trump's video, there were many falsehoods and inconsistencies in that. He had a completely inaccurate description of the situation. And I'm sure you've probably reached out to Cooks, who can provide a lot of clarity on ownership and actually the truth and the facts of the matter. And we continue to support the New Brunswick fishing industry in the conversations about jurisdiction and who has the rights to fish in what waters between New Brunswick and the eastern seaboard of the United States. So I believe that seafood does continue to be a part of the conversations in the trade talks that the team that Minister LeBlanc and Ambassador Hillman and others are having with the different U.S. leaders. But as you say, the president has been focused on dairy, on supply management. I say focused, to be honest, his focus appears to change by the week. And so we continue to make sure that New Brunswick's interests in our seafood, our agriculture, our forestry products, our energy products, and more are being well represented by Team Canada and the folks that are at that table trying to get the elimination of all tariffs and a new deal between the U.S., Canada, and Mexico that works for our country.
Thank you. Alexandre Boudreau, Acadie Nouvelle.
Good day. What do you answer Megan Mitten, the member for the Green Party, that says that the province should not build any new fossil energy project and only use renewable energy in the context of this new natural gas that's going to be built? We are listening to New Brunswickers who tell us that they need electricity that is reliable, affordable, sustainable, and absolutely with the least emissions possible. At this point, it is not possible to succeed, to reach the objectives of affordability for New Brunswickers without having many other different sources of energy. Certainly renewable, we've made increases in our wind power, solar, and more over the past few months. So frankly, and we're continuing to look at our needs for electricity, hydroelectricity and the nuclear, and all opportunities to make sure that New Brunswickers have access to the electricity they need in the most affordable manner possible as well, and the most sustainable possible. Some of our objectives that we must balance the needs, but New Brunswickers were clear for us the issue of affordability and a question, a priority question at the time. So our team and the team that manages the independent review that is being done now are receiving a lot of feedback from sources of electricity generation and good conversations with experts in the sector and public commitments where New Brunswickers continue to make clear what their priorities are on affordability and the need to have a balance with the NB Power. I understand the decision to go with Pro Energy was made in 2004, but there's still new tariff challenges that were made. It was done with American businesses. Doug Ford, for example, at starting and with deal with Donald Trump. Are you going to cancel this project with Pro Energy if other tariffs are imposed close next time? Or is it a question about the energy needs that you mentioned? But the question is really options. Are there any other options? Was there a Canadian option or from another country to choose? And it was not the case here. And that exists with other products and services as well. If there are no other options that we can choose, well, it is a need. The reality is that we must continue to do a bit of business with the United States. So in this case, with this project, the assessment was done, and the only option that succeeded to reach the objectives for the delay as well as for the costs with the American option. But we're looking at each case, we're looking for each opportunity to cancel a contract and replace that service or that product with something that is Canadian or from elsewhere. So you've seen that NB Alcohol New Brunswick, we didn't put American products on these like was done in other provinces. We didn't put many. New Brunswickers are continuing to show their preference for New Brunswick products, and we're continuing to use all the tools possible to make sure that when there is a Canadian option, we purchase it. But it's not the option in this case. And from what I understand, there was no Canadian option. That would reach your objectives for the delay. Global News, Anna Mandan.
State, you've talked about the things your government has done to ease the load of alternate level of care patients, but the reality is these hospitals are still at and over capacity. Why is that, and what's the disconnect?
Well, I think that's a great question because there's a lot of different pieces that go into this. Some of it is population. So our population has grown and is aging. And so those forecasts of the people that will be needing alternate levels of care and long-term care has increased and increased and increased more than the beds that we've created in long-term care facilities and our capacity to serve in hospitals at the same time as the pressure on emergency rooms has increased due to the challenges that we faced in primary care with an outdated model of care and a history of not moving quickly enough to transform how we deliver care in New Brunswick. And so we have a perfect storm in our ERs, and then we have a growing and aging population that has put more and more pressure on the beds in our hospital system. And I would say a lack of priority or movement on the preventative things, so that the work in home care hasn't really had any attention over the last number of years, and yet it's the best and earliest way to prevent people from finding themselves in that situation. The need to transform primary care, as you've heard me say a million times, was not given priority by the previous government. They committed to 4 collaborative care clinics in multiple years' time, when what we needed was a whole-scale, aggressive transformation of the models of delivering primary care to make sure New Brunswickers had that access and weren't finding themselves in emergency rooms. And then you add to that the demographic storm. And so we're well behind the 8 ball and trying to play catch up. But our government is throwing everything we have at this. As I mentioned, the home care transformation work that we're doing, the contract that we successfully negotiated with nursing home unions, relationships to expand extramural services, the Nursing Home Without Walls program, the transformation of primary care, new relationships with the health authorities and how they change the way they deliver emergency care, and policy conversations about how we manage alternate level of care beds and people's admission into, and even assessment. We've accelerated the assessment process that used to take months and months to get someone from social development to come into the hospital just to get the assessment done to determine what bed they might be eligible for. We have been going after all of those things over these last 7 months and making some progress, but the progress needs to be as quick as or quicker than the demographic storm that we're in.
Yeah, and I hear the things you've mentioned that your government is doing, but Horizon is still saying that in recent weeks, the number of these patients has been their record, their highest. So if these aren't, if they're at the record level now, when will the measures your government is putting in place start to impact that?
Well, that's an excellent question, because we have been doing these things as quickly as we can over the last 7 months to make sure that some of those beds that are available in long-term care are now staffed, and we're starting to see the benefits of the new contract and those efforts starting to pay off as we have some beds that are now staffed that we can move a few more patients into. We're seeing significant uptake on Nursing Home Without Walls, but as I mentioned, and folks would have noticed this at the State of the Province, when we articulated the measure around the number of people waiting for long-term care, I know there were some people upset because we had it flat, right? It was 1,068, and our goal was to keep it at that level, because the current demographic projections would see the number of people waiting in hospitals and waiting at home for those beds going up exponentially. And so for us, it was the best we believed we could do was reduce that exponential increase such that we were maintaining the list as is, even though we would have been delivering hundreds of more services to people. And so that's where we're at right now, a demographic storm that is putting a high degree of pressure on the numbers. And while our services are increasing, and there's more people receiving long-term care and more people receiving care at home and more people receiving care through Nursing Home Without Walls programs and extramural programs, it hasn't yet reached that demographic pressure point. And so we're 7 months in, we're starting to see some of that work snowball a bit, but there's a lot more to be done.
Nick Moore, CTV.
Thank you. Good morning. We heard last week from the duty-free shop in Woodstock that it would be closing by the end of the summer. Aside from duty-free shops, are you hearing, or opportunities New Brunswick hearing of any other industries, businesses that are really at that brink, that breaking point right now because of the trade war?
At that breaking point, we're certainly hearing from right now companies that are in the steel or metal business, where that's a critical input to their products and services, that are having fiscal impacts, and that's putting pressure on their profitability. And so those are conversations we're having. We're seeing that in some of our seafood sector, where we have groups of fishermen and women that have seen the pressure on their pricing and their clients that is impacting their ability to sell their catch. And so we're working with those groups as well. But I haven't heard of another, I'm about to go out of business. I'd have to check with Opportunities New Brunswick, because they're the ones on the ground in community with those entrepreneurs, working every day with the people that are navigating through these tariffs.
We've heard from the administrations at the McDonald Farmhouse, Minister's Island near St. Andrews, saying about a funding shortfall that is really threatening their operations, their future. They're blaming the provincial government and cuts to the Department of Tourism, Parks and Heritage. what can you say to these organizations about their future? Do they have a future?
Yeah, the situation is really challenging with a number of our heritage sites where we renewed the funding that was provided in previous years at the same levels as Minister's Island received in the past, and at the standard operational level for McDonald Farm. So their funding committed was the funding they'd received in previous years, but their costs to operate are going up, and that's leaving them with shortfalls. And at this point in time, the government does not have additional monies to put more monies into those heritage sites. And so we're working closely with the operators that have chosen not to move forward with operations this year. We're working closely with the communities to try to find paths to make sure we can preserve those historic properties. We can ensure public access to them and figure out a way for future viability and sustainability of some of those places that hold New Brunswick's rich history and stories, and that we want to make sure stay protected and preserved for future generations.
Aidan Rayner, CHCO TV.
Hi. How is the province developing support for communities reliant on major industries like food processing, who are most impacted by the U.S. tariffs? It's unlikely at this point that our major industries will feel secure for the next 4 years under President Trump. So how is the province making sure New Brunswick industries reliant on industry-reliant communities will see it through the next 4 years with, secure jobs?
Well, we put in place a pretty comprehensive tariff response package that included funding for businesses that were experiencing challenges based on the tariffs and the trade war with the U.S. That included funding for communities that are home to some of those industries that we're seeing the impacts. And so RDC has had funds available to work with communities experiencing those challenges through Opportunities New Brunswick and Department of Agriculture, Aquaculture and Fisheries. The supports are there for both industry and communities to come to us and to work with the team on their specific and unique challenges, and to make sure those businesses can continue to operate successfully, that their entrepreneurs and the workers are receiving the supports they need, as well as the communities that they call home. So that program and that suite of supports remains in place. And the team is constantly in conversation with mayors and councils and entrepreneurs about what they need and how and what tools we have to help them.
Aidan, your follow-up?
As the province seeks to build more homes, there will be an increased need for people to build them. How is the province planning to meet the labor demand with its goal of building more homes? Is that working with NBCC to lower tuition, say, for those jobs in need?
That's a great question, Aidan. Thank you for that, because it gives me the opportunity to talk about something that has concerned me over the last bit, and that is the number of people that New Brunswick has access to in these critical skilled areas. So while we do everything we can to make sure that the training programs are available for New Brunswickers that want to learn those skills, or the retraining programs, that they're cost effective, that the scholarships, bursaries, and tuition credits are in place for people to study in the fields like construction and the trades, as well as working with those building trades unions about what they need, about apprenticeships, about how we can get that next generation of talent in. Our own direct birth rates are not contributing to meet the demand that our construction sector has for the amount of people that we need to build all the homes that New Brunswickers need. So that's where immigration comes in. And we had experienced a 50% cut in our immigration quota from the federal government a number of months ago, from 5,500 down to 2,750, and we've been negotiating ever since to try to get that total back up to its previous level. We haven't gotten there yet, although we have gotten the feds to agree to increase it by another, I think it was about 1,500 and some more spots, because those are immigration spots that we allocate to people who are coming in with those trades skills and construction experience, as well as people coming in with the healthcare qualifications that we need to fill the vacancies that we have in our long-term care sector, in our hospitals, and our primary care sector. So part of it is an immigration strategy to get the talent we need that the construction sector and our home demand sector requires, and part of it is partnership, as you say, with NBCC, with CCNB, to make sure that the programs are available, that the terms of those programs are flexible, and that supports exist for the costs of that kind of training so that people can choose to get the skills that our economy needs to join our construction sector.
Alexander Johnson, All New Brunswick.
Good morning, Premier. I wanted to touch on the natural gas plant again. With this major natural gas generator in the province, and we've also seen some interest from Utica Resources in discussing natural gas development in the province. I'm just wondering, where is the province policy at today as far as developing natural gas here in New Brunswick?
Thanks for the question, Alex. So our policy for developing new natural gas resources remains unchanged. The terms of the moratorium and the 5 conditions required to lift the moratorium remain in place. And thankfully, there is a significant amount of natural gas being developed both in our country and in our neighboring countries that we believe that New Brunswickers could and should have access to and the benefit from. And so we are working with the federal government, as you may have heard me talk about, to try and get an extension of that natural gas infrastructure from Quebec into New Brunswick to support New Brunswickers and our energy systems. And then there's this natural gas plant project that NB Power has been working on that has been moving into the next stage with the award of the contract and the identification of its future location.
Your follow-up?
Thank you. I just wanted to ask you as well about the mineral strategy and if there's any update on progress on that.
Oh, there's been a lot of work done on the mineral strategy, actually, as Minister Herron and the team have been engaging with both the federal government, with our prospectors and developers here in New Brunswick, with the owners and proponents of some of the current developments that we have, as well as something interesting that we were talking about yesterday, that Minister Herron informed me that we have about 1,000 kilometers worth of core samples stored in a warehouse here in New Brunswick. Core samples from all sorts of different regions across our province to help identify what kind of minerals existed in the province. But most of those core samples were collected quite a long time ago. And so there's a new project being explored to do a new digital and technological analysis of these core samples to get more information out of them, to know exactly what, to develop that sort of digital plot and mapping of New Brunswick's geology with assets and resources that we have available to us, but with the new technology that wasn't available when they were first cored, to get more and more detail about the nature of those resources, where they are, their density and their quantity, to help us better set up and identify the best places for development of that resource and to the extent that it can be developed. So we're excited to leverage those core samples and that 1,000 kilometers with new technology that'll give us better data on what we have and where it is. And we continue to work with the federal government on how to make best use of New Brunswick's resources in a way that's in the interests of our province, of our people, that is connected to our national economic, defensive, and environmental strategies to ensure that New Brunswick can grow its economy at the rate that we need to support the growth and demand for our health and education and other services.
Thank you, everyone. That concludes today's press conference. Voilà la fin de notre conférence de presse.
That's the end of our press conference. Thank you, everyone. Thank you. Merci.